As a public service, Capital Broadcasting presents In Focus, a more in-depth look at some of the more worthy causes and events taking place in our community. I'm Gary Russell. Today we're talking about HPV, the human papillomavirus, and the vaccine to help prevent it. With me today is Dr. Karen Zempolich, a gynecologist oncology doctor, as well as Ashley Milliron, a mother of four and HPV survivor. We've all heard of HPV, but not everyone knows exactly what it is. Dr. Zempolich, can you tell us what is HPV and what we can do about it with the vaccine now?
HPV has been around a long, long time. It is sexually transmitted. Meaning with intercourse, this virus is transmitted, but it's incredibly common. 80% will have had it at some point across their lifetime. There's over 100 strains of the virus, and probably about 30 to 40 are really clinically important in that they cause precancers and cancers as well as warts on the hands and on the genitals.
A lot of people that I know, and I'm the father of two daughters, and when this first was a big revelation many years ago, I guess it would have been, because my 28-year-old was probably in that 12 to 13-year-old range. And myself as a father and my wife and our friends were all scared because we had heard, oh my gosh, this is for sexually transmitted diseases. We don't need our 13-year-old to get it. What's the history behind that and kind of the misthinking that's out there on that?
Well, I think that's a great point. I think that really cuts to the heart of why sometimes it's tough to talk about HPV and really make a difference in preventing something that can be very catastrophic both for fertility and for life in terms of developing HPV cancers. Fortunately, many people do clear it at some point, maybe 90 to 95%, but it's so common that the burden of disease is high enough that vaccinations have come around. Another important thing is that it's not just with sexual intercourse, even just touching of the genitals, or what some folks or parents would be, okay, we're talking about kissing and hugging and maybe something that maybe we don't want to talk about here on the radio, but also not something so scary to parents, still can transmit the disease and transmit the virus.
And originally, we were told girls only, and then at some point this transitioned into boys as well. How did that happen and why?
I think that it was first very well studied in girls. Girls are more commonly affected by the processes that HPV can unfurl in folks. And in particular, we think about cervical cancer, and as a cancer doc, I want to prevent that. But I think it's also important to recognize that nearly 1 million young women in this country every year have a severe precancer that causes not only tests, but procedures that take off portions of the cervix and can threaten fertility. And I think because of the volume of those numbers affecting young girls, it probably got tested first in that. And then after actually thousands, probably one of the most heavily tested vaccine testing began in boys, and then FDA approval as well unfolded for both boys and girls. And of course, any vaccine in a community is going to be best effective if you get both boys and girls.
Sure.
If they're going to if we treat only girls and the boys continue to harbor this virus, we're just going to have it traded back and forth and not really make a dent in diminishing this virus.
Also joining us is Ashley Milliron. Ashley, you're a mother of four and an HPV survivor. Tell us a little bit about your story, how you found out, what the process was, and just give us a background of your experience with HPV.
Okay, so I think I was 25, and I had just had my second child, and I went in for a 6-week checkup and was also doing a Pap test at that time, and it came back irregular. And so I had to get a colposcopy where they took some cells to test to see what the deal was. And it came back that I had HPV, and I had a strain that could cause cancer. So I had cryotherapy to, I think about it when you get a wart frozen off. It was kind of that idea, but they were freezing my cervix, and it was not pleasant. But since then, I've been good. So I'm 33 now, so that's been a while.
So if I'm understanding this correctly, back when you found out you had this, there was not a vaccine for her at this point, or she just didn't get the vaccine?
There was one, and I actually when I got it, there was 3 doses,
right.
And I had 2 doses, and I got the 3rd dose the day I had the Pap test that came back irregular.
So, doctor, that tells me then that all 3 doses are extremely important. Had she gotten the third, obviously a better chance that she might not have developed HPV, yes?
I think that's true. Some of it's timing as well, in that sometimes HPV is already around when young people are getting vaccines, which is okay. We still find it very valuable, just not as effective. In fact, if you get vaccines on board before any sexual activity, any exposure to HPV, it's nearly 100% effective at preventing the infection and preventing cancers and precancers. It drops down to maybe 50 to 60% if there's been some exposures. That's still good, but it's not going to be 100%. And in terms of the vaccine schedule, there's actually been some improvement in terms of the accessibility to how many vaccines a child will need. We recommend the vaccine to be given at 11 to 12. And if you start around 11 to 12, it actually now is a 2-shot series, which is really great because no kid likes shots. No adult really likes shots either. If a woman or young boy, young man receives the vaccine series starting after 15, it's a 3-shot series. And it is important to finish those 3 shots to get the full protection that the vaccine affords us.
When the vaccine came out, I was already 23. So if it would have been out when I was 10, 12, for sure I would have been, and all 4 of my sisters, we all would have had that. My younger sisters have it. But because it didn't come out till I was 23, I think I kind of missed the boat. But I'm glad that it is out now for those so they don't have to go through kind of the stress and the hard things that I had to go through.
No, I get it. I mean,
Yeah.
and that's perfect. Awareness is everything. I
Yeah.
mean, and this is why we're here today, to make people aware how important and how we can avoid what you had to go through simply by getting these shots when you're 11 to 15 or whatever the doctor recommended.
Well, I think Ashley also points out an important fact that if a person hasn't received it by 11, 12, or 15, you still can take it up to 26. And in fact, it's probably effective, just not as highly effective or FDA approved after the age of 26. But we call it a catch-up dose between the ages of 13 to 26. And so it was wonderful that she got it. And it probably still has protected against other strains. Like I said, there's over 100 strains of this virus. The vaccines protect against a handful of them, of the most important ones to protect from. So it's always good if women are in that catch-up time frame up to the age of 26 to pursue the vaccine, even if they didn't get it at its most optimal time at 11 or 12.
Capital Broadcasting's Gary Russell. We are on In Focus today talking about HPV with Dr. Karen Zempolich and Ashley Milliron. We hear a lot in the news today about the anti-vaccination movement and the people are afraid, don't vaccinate your kids, do, et cetera, et cetera. Is this vaccine, I mean, you've mentioned the FDA, it's approved, obviously. Side effects, are people fighting this? Or tell me a little bit about the kickback, if there is any, on this particular vaccine.
This is one of the most, if not the most, well-studied vaccine ever to be rolled out. In fact, once it has been FDA approved, at this point we have over 90 million doses given, and the safety profile is excellent. Other than pain at the injection site, like most shots, really there are no serious side effects. I think the statistic is less than 0.00003% of folks will have any side effects. So very safe, very effective. In fact, women can get it while they're breastfeeding. It's safe in that context. We don't recommend it during pregnancy, but if a pregnancy happens during the series, it's okay. There's been no effects on fetuses noted. And after the completion of the pregnancy, then the series can be continued. So very, very effective and very, very safe.
And what about prior to a pregnancy? Any chance of infertility or any other complications if when they are young women getting these? Is this going to affect their reproductive process at all?
No, there is no effect from the vaccine in terms of their fertility. In fact, you can argue the opposite in the sense that unlike folks that end up having to have freezing procedures or portions of the cervix removed, it's really preserving of fertility. Very, very safe in that regard.
And once they've had the 3 doses, whether it's young men or women, is that it for life? Is there a booster down the road, or does this last for the rest of their life?
Well, so far this vaccine's been out in full force over the last 10 years, and we've seen no decline in the effectiveness. So there's no booster at this point that's been recognized as being needed. So it's effectiveness lasts, we think, its lifetime.
So we're talking about HPV today, human papillomavirus, and we're recommending that both men and women, young men and girls, get vaccinated. Run us through that again, doctor, if you would, about the dosages and the age groups of when this should begin.
So we recommend both girls and boys receive the vaccine around the age of 11 and 12. In that age range, from 11, actually as low as 9 has been studied safely, but at least by 11 to 12, we recommend vaccine be given. In that scenario, fortunately, those young people can receive just 2 vaccines separated by 6 months. 2 shots, 2 vaccines. After the age of 15, then it's a 3-shot series to get the full effectiveness.
And so that's something relatively new. As I said earlier, when my daughters were getting this, 10 years ago, it was a 3 vaccination process, and it has since been narrowed down to the 2.
Exactly. So it's now 2 for that age group of up to 15.
So the optimal age here, you're saying, is about 11 to 12. However, you mentioned that you can do this as young as a 9-year-old, and there's no problem with doing it that early. Is there a benefit to it? Talk to me about someone that young getting the vaccination.
Well, actually, the sooner we get these young people vaccinated, the better for a couple reasons. One, their immune systems and their response to vaccines are much stronger. In fact, that's why we can now give 2 doses only instead of 3 to children up to the age of 15. After that, our bodies do a good job, but not as robust a response to the vaccine. So we want to take advantage of the body's own ability to create the response. The other advantage is that we really benefit the most when we get these vaccines on board before exposures. And as much as it's hard to really process sexual activity, whether it's full intercourse or kind of touching and petting, whatever phrase you want to use, is very common. In fact, national studies have shown that by the age of 14 to 15 or 9th grade, 1 out of 3 9th graders has been sexually active. And in that situation, while that's kind of hard to tell anybody that has kids going into 9th grade, it's really the reality. And by 12th grade, it's about 2 out of 3. So if we can get them vaccinated before any exposure, then it actually prevents it.
I'm guessing, and correct me if I'm wrong, doctor, girls are probably getting this on a more frequent rate than boys are at this point. This started out concentrating on young women, and then boys were added. As Utahns, how are we doing in vaccinating our children for HPV?
Unfortunately, here in Utah, we are not doing very well at all. In fact, as a country, we're not doing that well compared to other first world countries with access to vaccinations and Pap smears and all of the kind of what we consider first world medicine. We're among the lowest rates of uptake of vaccine. Across the U.S., about 42% of girls in the appropriate age range have received vaccine, so less than half. For boys, it's less than 30%, about 28%. Here in Utah, we rank amongst the lowest, 49th out of the 50 states for uptake amongst girls, and I think similar for boys.
So we definitely need to get the word out. This needs to be done, and hopefully something like this today will get the word out and more people will get out and get vaccinated. Capital Broadcasting's Gary Russell. We are on In Focus today talking about HPV with Dr. Karen Zempolich and Ashley Milliron. So you've had the HPV vaccine, you're living life, it's all good. Ashley ended up with HPV. She was in the process of the vaccine. How do people know when they have it, and what is the process from there?
Well, I think since 80% of sexually active adults have had it, I think we can all assume that we've been exposed. And I think that's, first of all, the most important thing to process. Once you have been exposed, there's no benefit to looking whether it's been cleared or not. So when it's been identified, either because of an abnormal Pap smear and treatment, there are some tests that we can do, actually, to look for HPV, whether it's gone away or not. But it really doesn't change the fact that we're still going to want to be able to watch young women, especially for cervical precancers and vulvar and vaginal precancers. So it doesn't take away the importance of Pap smears and of physical examinations. It just hopefully takes away the diseases being found. But it's going to be critical to maintain that relationship with family practice doctors, internists, and OBGYNs, to maintain really good pelvic exams on a regular basis and follow their recommendations for how frequently that should occur.
So in addition to women having their annual Pap test, is there a situation where someone might think, oh, wow, I better go have an HPV test? Or will this something that will just come up during other routine exams like you're talking about?
There really isn't a role just to look for it. If we did that, then it would lead to many, many tests and procedures, much like Ashley described, that actually aren't particularly important to do. We can't eradicate the virus with the vaccine. It's a preventive, but it's not a treatment vaccine. We don't have a way to get rid of the virus. So using the other forms of surveillance to look for problems is much more important. And the Pap smear screening has changed over the last 5 years or so. It now begins at age 21 so that we don't overtreat young people who might obtain the HPV infection but actually clear it without any long-lasting effects on the cervix. So we're trying to find that right balance in the medical community of being vigilant but not over-treating. And, of course, preventing will be by far the best.
Right. If someone does end up, like Ashley did, with HPV, are there different kinds of treatments? Is it like other cancers? There's extreme, and there's chemo, and there's surgery. What are treatments if you do end up with HPV?
Well, Ashley mentioned one that's really quite effective for pre-cancer, so cancer or changes of the cells that left untreated would turn into cancer. We kind of step up from there. We can remove small portions of the cervix. Ultimately, though, if we don't detect these precancerous changes and cancer occurs, then we have pretty extensive surgeries, and that's what I specialize in, called radical hysterectomies, that have to remove the cervix, usually the uterus, take biopsies of lymph nodes, and unfortunately that's only available to the women that we catch it in the first stages. Everybody else end up receiving radiation therapy over 6 weeks and chemotherapy, all of which we hope to cure, and certainly all of which makes fertility no longer an option for women. If we can prevent, that'll be the best. We have a great screening system in place. Most women who go on to develop cervical cancer have not had Pap smears or pelvic exams for more than 5 years. So the combination of surveillance for the problem and prevention of the infection are going to remain important for generations still, until vaccines are so ubiquitous that we've stomped it out.
So avoid the radiation, avoid the chemo, avoid the cryo, and get the vaccine.
Absolutely. And, I have 2 daughters. They are 12 and 15. They've gotten their vaccine. And I can tell you a couple things. One, they don't even ask what this shot's for. They're so used to getting shots in their pediatrician's office. 2, there's numerous studies that demonstrate that giving a shot that prevents an infection that's transmitted sexually does not increase sexual activity. It's just not going to promote that. And in fact, I talked to my older daughter, who's wise beyond her years, and she's like, that's not going to make me do anything I don't want to do. That's what I get from her anyway. So it really can just be a matter of course. And if we can move to that, we will hopefully put me out of business in terms of taking care of these cancers.
We've covered a lot of good information here today. We, have a limited amount of time. If people want to research this further and want to take a look, where can they go do that?
Well, always I think it's very helpful to have good discussions with your gynecologist. They're an amazing resource, and they have often resources in their offices. For folks that have access to the internet, the Department of Health has a site, cancerutah.org/HPV. And that has a wonderful site. In addition, the American Cancer Society also has wonderful information. Fortunately, it really takes a village to help treat a population-based disease, and really pediatricians, at that age are the ones delivering it, the vaccine. So I would encourage folks to talk to their pediatricians. Women tend to have access to their gynecologists, and that's a good resource as well. Internists, family practice docs. I think pharmacists can also speak to the safety of the vaccines. The Department of Health has a wonderful program for vaccines for children that can also explore that further. One thing that I think is relevant to the timing of the vaccination and getting it on board before exposure is that of the 14 million cases of HPV newly infected every year, about 3/4 affect folks in the 15 to 24-year-old range. So this really is a process that's transmitted and affects young people. So we need to beat that time frame and get them vaccinated. I think what's important to note is that this virus, HPV, doesn't just affect the cervix. That's what we see a lot of, or what I see a lot of, but it also causes 5 other major cancers of women and men. So vaginal cancer, vulvar cancer, cancer of the penis, as well as of the head and throat and the anal region. So if you put all of those cancers together, it affects nearly 100,000 people a year across the United States, while each one of those is smaller than some of the other cancers we talk about. So this isn't just capturing prevention of one type of cancer, but 6, and the only vaccine that prevents cancer.
Dr. Zempolich, despite our best efforts to get vaccinated and prevent this, some people will inevitably get cancer. But with everything we know now, it appears that this particular cancer and the HPV can be prevented.
Unfortunately, I see folks that have particularly developed cancer, and I had a father once ask me, when they were asking me about whether to deliver the vaccine or have their pediatrician to deliver the vaccine, he commented to me that he couldn't imagine that with it available now, how he would look at his daughter and say, hey, I don't know why I didn't get you that vaccine, and now you have to deal with cancer treatment. And I didn't have anything to add. I think that would be a tough thing to say. So as parents, we have to advocate in so many ways, and we can teach them about what behaviors we want them to engage in, but that doesn't negate that we can protect them from cancer.
You've been listening to In Focus, a public service of Capital Broadcasting, bringing to light some of the more important and worthy causes and events taking place in our community. I'm Gary Russell. Thank you so much for joining us. I'd like to thank our special guest today, Dr. Karen Zempolich, gynecological oncology doctor, and Ashley Milliron, a mother of 4 and HPV survivor. We brought to light many issues today surrounding the vaccination and the treatments for HPV, but most importantly, the preventative aspects to avoid HPV at all. For more information, you can go to cancerutah.org/HPV. That's cancerutah.org/HPV. Or ask your family physician, pediatrician, or gynecologist. I'm Gary Russell. Thank you so much again for joining us on In Focus.